We come across so many couples every single day who've been struggling to conceive. Infertility has become a very common problem these days, and if you look at the statistics, almost 1 in every 8 couples struggles with difficulty in conception. We as a society often tend to associate infertility with a female problem. But did you know almost 30% of cases of infertility are because of male factor infertility? So males also have a very big contribution to make when it comes to helping a couple conceive, and hence understanding the factors that can affect a male's fertility is very important. So in this video, we're going to discuss in detail the causes of male infertility. If this is something that you would like to know more about, definitely watch the video till the end. Hi everyone, this is Dr. Zainab Tajir. I am a homeopathy consultant and psychological counselor. I help women balance their hormones and help couples conceive naturally through homeopathy and holistic lifestyle changes. So if you fancy content around this, do consider subscribing to my channel. For a male to be able to impregnate his wife, there are 2 factors that play a very important role. 1, he should be able to produce healthy sperms so that the sperms can fertilize the egg. And second, he should be able to maintain an erection and ejaculate well so that the sperms can reach the egg. A problem with either of these can contribute to male factor infertility. So let us delve into problems that can contribute to male infertility. The first factor is disorders with the sperms. So it's very important for a man to have a good sperm count, good sperm motility, so that there are more sperms that are rapidly progressive, and a good sperm morphology, that is normally shaped sperms, so that they can be able to fertilize the egg well. The factors that can result into abnormality of these are, the first one being either inflammation or infection. So if you've had developed mumps, especially in your youth, or have had any severe viral infections, it can affect the sperms. Secondly, hormonal imbalances. So imbalances in the hormones like FSH, LH, testosterone, etc. can also affect the sperms, since all of these hormones have an equal contribution to make in the process of spermatogenesis, that is production of the sperms. Thirdly, your lifestyle factors have a huge role to play. So if you are somebody who does not have any physical activity, leads a very sedentary lifestyle, has tobacco use, alcohol use, drug abuse, use steroids, etc., all of this can also contribute to affecting the quality and the quantity of your sperms. Environmental toxins is another factor. So exposure to a lot of chemicals, pesticides, plastics, etc. in the environment can also affect your fertility. Lastly, it could also be genetic factors. So Klinefelter syndrome or Y chromosome deletions, etc. This causes genetic mutation in the sperms and thus makes it difficult for these sperms to fertilize the egg. The second most important problem is a structural problem. So any blockage in the structure of the genital tract that can block the flow of the semen can also contribute to male factor infertility. Therefore, having adhesions, having inflammations, infections because of STIs, which can cause blockages in your genital tract. One of the most common reasons that we also come across is varicocele. So varicocele is the swelling of the veins in the scrotal region. Because of this swelling, there is increased blood supply in the scrotal region, which causes increased temperature, and this temperature is not favorable for spermatogenesis. So again, having grade 2 or grade 3 varicocele or even grade 4 could be a contribution to your infertility. And the last factor, like we already spoke about, is erectile dysfunction or premature ejaculation or difficulty in ejaculation. This is actually a much fairly common problem than we assume it to be. A lot of men, especially when trying to conceive for a while, struggle with performance anxiety, which makes it difficult for them to perform, especially during the ovulation days. So this has majorly got to do with your psychological factors rather than structural problems, and counseling and couple therapy can be very useful for this. If you believe your partner is struggling with infertility, it becomes extremely important to run the necessary tests like semen analysis, hormonal tests, USG of the scrotum, etc. to figure out what is the cause of his infertility and accordingly treat it. So I genuinely hope this video has been helpful for you. If you have any more questions, please feel free to leave it in the comment section below. And thank you for sticking by till the end. I will see you again next week.